Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Glen Cove Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, as always, we want to hear from you, so call us at the number right there at the bottom of your screen, 516-393-1800. Well, Governor Cuomo says 3 regions of New York will begin to reopen. That'll be at the end of the week. Now, he says the upstate regions have met the 7 benchmarks required to begin phase 1. That's just one phase. It's going to be phased in. Nassau and Suffolk are only on track to meet 5 of those 7 metrics. Governor Cuomo today also confronting critics who say the state should just reopen quickly. He says the process will be done slowly and monitored by region to help prevent a second wave. Now, here are the numbers. Statewide, we now have 338,000 who tested positive for the coronavirus. Let that sink in for a second. 338,000 statewide. New York State health officials say this includes 100 cases of what they're now calling pediatric multi-symptom inflammatory syndrome. That is a rare and dangerous inflammatory syndrome that afflicts children and appears to be tied to the virus. Now, Suffolk Executive Malone says there are 7 kids right now in Suffolk hospitals with this COVID-related illness. Here on Long Island, more than 75,000 positive cases of COVID-19 have been identified. That's just here on Long Island. And deaths are mounting in New York as portions of the state are ready to reopen. The death toll across the state is hard to fathom. Look at this right here. It's more than 21,000 people have died from this. This includes 3 children, according to the governor. Now, the Nassau and Suffolk death toll is now more than 3,600. All right, let's get right to our conversation. Joining us tonight again is Dr. Payal Sud, the Associate Chair of Emergency Medicine at Glen Cove Hospital. Appreciate your time. I think last time we talked was in March, so you've been very busy. I'm sure it seems like a lifetime for people in your profession. How are you holding up?
Thanks for asking and having me. Holding up good. Definitely feels like more than 2 months ago. A lot has happened in the last 2 months.
Yeah, so I know that Glen Cove, as a lot of hospitals, you had a huge number of cases. What's the capacity right now?
So the capacity in the emergency department right now, we are definitely equipped to see any and all patients coming in. I think we hit overall in Northwell our peak somewhere around April 7th. After which the number of new cases coming in with COVID-19 did start to decline. And that started off with the numbers presenting to the emergency departments going down. That being said, a lot of our upstairs in the hospital, so the inpatient wards and ICUs, do have a large number of patients, but that number is decreasing as well. We're discharging more and more patients every single day. Okay,
well, that's good news. Let's try to get a couple of questions in. Nedlam from Selden?
Yes.
Are you there? What's your question tonight?
My question is that my mom is 84 years old. She was hospitalized 3 months ago. They gave her a lot of Lasix and steroids. After that, she's so fine that you can't believe she's 84 years old. Why can't the doctors try the steroids as well as the Lasix or the water pills in the most complicated cases? Maybe that can help the people to die, that can help them to live, long.
Thank you for sharing your story with me, and I'm so glad your mother's doing well. Now, you're absolutely right. We have given steroids and Lasix, a diuretic or a water pill, to some patients. One of the things that we're seeing with this virus, unfortunately, is that it presents very differently in different patients. And so it's not a one-size-fits-all by any means. So whereas with some patients, we need to give them some fluids to maintain the blood pressure, in others, we need to give them Lasix to try to get some of the water off. Same thing with steroids. In some patients, it's helping to reduce the inflammation, whereas in other patients, steroids increase your chance of other infections, so it could make things worse. So that's why in some patients it's been helping, with others it hasn't been, but I'm glad it helped for your mom and that she's feeling better.
Yeah, that's good news. Emma, are you there from Babylon?
Yes.
What's your question tonight?
I was wondering if you have blood thinners, can that protect you from getting that virus?
I'm sorry, can you repeat your
blood thinners she asked about.
Oh, blood thinner. Yes. So again, another strange thing that we're seeing with this virus is that it's increasing the risk of blood clots in patients. So that being said, we are looking at patients, especially the ones that are hospitalized and in certain cases that are sicker and in the ICU, to see if starting these patients on blood thinners would help. And in select patients that meet those criteria, we are starting them on blood thinners. Now, again, like I said earlier, it's not a one size fits all, and blood thinners are not without risk. So it would not be ideal to start every single patient with coronavirus on blood thinners, but certain patients, absolutely. And we are doing that.
What about remdesivir? I mean, that seems to be what is commonly used at this point?
So remdesivir is definitely being looked at. It's one of the more promising drugs out there currently. However, again, I'm saying this with some caution, just like all the other drugs that are currently in a lot of clinical trials being done by Northwell. So far, remdesivir has shown some promise in, again, select patients and when given early, and more research definitely needs to be done to really tease out which subgroups are going to benefit the most from remdesivir. And I mean, I hope it works, but by no means is that a miracle drug like any other drugs out there. Unfortunately, we don't have one right now.
Yeah, all right. How about Marianne? Are you there from Williston Park?
Yes.
What's your question, Knight?
The question is, does an alcohol wipe kill the virus on contact, or am I just spreading it to the next surface?
So this is an excellent question. A 60% alcohol would kill the virus. So I think if you're using an alcohol wipe to clean your surfaces, you're absolutely doing the right thing.
Okay. What about Lori? Are you there, Lori?
Hi, yes. My question is, my younger son, who is a completely healthy 5-year-old boy, was born with only one normal functioning kidney. Would this be considered an underlying condition? And besides the normal precautions, is there anything additional I should be aware of?
I would definitely be a little bit more careful with him, given the fact that he was born with one kidney compared to someone who has 2 functioning kidneys. Because this virus, again, along with all the other things that it's doing, one of the things that it's doing in some people is that it's affecting their kidneys. Now, most people have 2 kidneys, so even if one kidney is affected, you kind of have another one to fall back on. So as your son has only one kidney, I would definitely try to be more careful with him.
Now, would someone in that particular state, a young child with an underlying medical condition like one kidney, would he be subject to looking for signs of this pediatric multisystem inflammatory syndrome?
Absolutely. So the pediatric multisystem inflammatory syndrome is a relatively new syndrome that we're describing now. There have been several cases in New York, several at our sister hospital in Cohen's, of this syndrome. It's similar to another syndrome that we've seen before after other viruses. It's similar to Kawasaki's. Again, as of right now, we don't know too much of this as to which kids would be more susceptible to it. More data is coming up about this. But again, if you are immunocompromised as a child, like anything else, you would be at a higher risk of acquiring this disease as with any other disease.
Yeah, all right. Good luck with that, everything, Lori. Let's try to get Tony in. Tony, you there?
Yes.
What's your question tonight?
Yes, my question is, I was concerned about a product that's out there concerning premature lungs. My grandson was born with not fully developed lungs, and they treated him in an incubator using surfactant. I was wondering if that would be beneficial to this virus that exists right now.
That's a great question, and that's also one of the things that we are looking at to see if there's any benefit from it. As of right now, again, there's not that much data to say one way or the other, but theoretically it might help. Let's see what we find.
Yeah. So are the main number of cases that you're seeing right now in the hospital, are those ICU patients, or are they patients that are there for a couple of days and then being discharged?
The main number of COVID-19 patients we're seeing right now, it's still pretty 50-50. You know, we are seeing a decent number of patients that we're discharging from the emergency department, but at the same time, we are seeing some patients that are extremely ill. And these are not just patients coming in with COVID-19. We're now starting to see a lot of patients coming in with other diseases that, you know, I think the message went out loud and clear over the past couple of months. Don't come to the emergency department unless you're really sick because of our fear of overcrowding. And now that we're past that peak, I think it's important for people to realize that if you feel like you're having an emergency, please seek medical care. And if that involves coming to the emergency department, please come. We're here to take care of you. We'll keep you safe from acquiring the virus, because what we're starting to see now, I hope we're not going to see a lot of it, where people are waiting too long and coming in when it's sometimes too late.
Okay. We're going to take a real quick break. We're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we always want to hear from you. Call us with your questions. The number right there at the bottom of your screen never changes, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Payal Sud, the Associate Chair of Emergency Medicine at Glen Cove Hospital. Just before the break, I think you were making an incredibly important point where people are so afraid to come into the emergency room that they're basically staying home sick. What do you say to parents who might be afraid to even get their kids vaccinated at this point? Is there an age where it's too young to go in?
No, you're absolutely right. I mean, especially with little kids, don't take any chances. Your first call, if you're concerned as a parent, should be to your pediatrician. I know several pediatricians' offices have been excellent with telehealth visits. If you have a child and you're concerned about their health, please call your pediatrician first. And if they're urging you to go to the emergency department, you should go to the emergency department. You know, we're definitely starting to see in our EDs the number of people, the total number of people coming in going down. And even though we are seeing patients with COVID-19, we have designated areas and ways to keep you guys safe if you're not coming in with COVID-related symptoms. So if you're concerned, please seek medical care. Don't be afraid. The important thing is we're here in the EDs and in the offices, the doctor's offices, to look out for your health.
Okay. Let's try to get some more callers in. Debbie, are you there?
Yes, I am.
What's your question, Mike?
Does the body keep manufacturing COVID antibodies even after they are donated?
You know, that's an excellent question. A lot of people are getting tested for antibodies to see if they have potential immunity against COVID-19. All I can say right now is we don't know, unfortunately, which patients after getting COVID-19 are even making antibodies, how long these antibodies last, and what degree of immunity they offer. So unfortunately, right now, I don't know, and I don't think we really know the answer to that.
Yeah, it feels like it's been going on for years, and it's really been going on since the end of February. So it's still really new. John, are you there?
Yes, I'm here.
What's your question tonight?
Okay, doctor, thank you for doing this, and thank you for being on the front lines on this pandemic. I can't thank you enough. My question is, I have a coworker. I've been in touch with him for 2 months. We're avid golfers, and in a conversation today, he had said to me that he has tested positive for the antibody, the IgG antibody. Now, I'm reticent to golf, but if I were to golf, I myself have not been tested. To the best of my knowledge, I haven't come in contact with the disease. The fact that he has tested positive for the antibody, would it be safe for me or anybody in these similar situations to be around a person like that?
You know, that's a very, very good question. The fact that he has IgG antibodies, again, we don't really know exactly what that means. Does that mean that he had COVID and he was sick from it and now he's developing antibodies? Or was he asymptomatic before, an asymptomatic carrier, and now he has antibodies? Or the antibodies that he does have, does that mean he's immune and or does that mean he's not immune and he's going to be shedding virus out? We don't know what that means. So I don't think we can use an antibody test to decide whether that means we can forget about any restrictions such as social distancing or wearing masks or washing hands and be around people or not. We can't base our decision on an antibody test right now.
Okay, let's try to get Joe. Are you in?
Yeah.
What's your question?
I have a quick question. With all the protests going on, will that increase the virus cases? Will those people get the virus?
Will that increase? I couldn't hear.
Joe, what was that question again? I couldn't hear you there.
With all the protests going on around the state, will that increase the virus cases to go up?
Oh, with the protests, people are protesting without masks.
It's simple answers, yes. You know, the more you're out there without social distancing, without masks, you expect to see cases rising. It's a direct effect of it, yes.
Right, and a lot of people still don't realize that the mask is protecting other people. It's not protecting you. Just because you feel like you're healthy, you might be spreading it because you may be asymptomatic, right?
Right, you might be an asymptomatic carrier. And remember, it's not just sneezing and coughing that drops off these droplets carrying the virus. It's speaking, singing, laughing, yelling, anything like that, and you're giving out respiratory viruses.
Real quickly, what kind of PPE supply does your hospital have? Do you have enough? Because we're hearing sometimes there's shortages, sometimes there's not, different spots.
I'm very fortunate, and I think the entire Northwell Health System has been great about this. Throughout all of our 23 hospitals, we've had adequate PPE supply. And now actually, going back to that antibody testing you mentioned, a lot of us healthcare workers at Northwell are getting tested for the antibodies. And so far, I think every single person that I've spoken to who does not recall being sick from the virus does not have antibodies, which means our PPE has been working, which is really reassuring.
Okay, well, unfortunately, we are out of time, but thank you again for everything that you do on a daily basis. You are really one of the heroes on the front lines, and we truly appreciate it. You work all day, and then you come in here and do this public service at night, so that's is tremendous benefit to all of us, so thank you very much. And thank you to all the viewers. We will see you tomorrow night at 7 o'clock. Stay safe.